I think it's important to prevent work-related stress because it's one of the leading causes now of sickness absence across industry. We have a responsibility as employers to support the people working for us, a duty of care to look after them.
Everybody's talking about work-related stress, and I think what people would love is a quick and easy solution that could be implemented and take care of the problem. I think it's really important that any employer understands that really to address this issue you have to use a wide range of resources and tools and approaches, and it's an ongoing conversation. There's a cultural challenge that we have to address within the workplace.
Mental health in our society is one of the greatest things affecting our population, and the workplace has an important role in that. Unlike most other illnesses and diseases, mental ill health spans every age group. And so those at work are at least as prone to problems as the rest of the population. And what happens in the workplace is important in determining what people's mental health is going to be. So even though the minority of mental health problems are caused by work, all mental health problems impact on the way that we do our work. So from an employer's point of view, you need to think about mental health, you need to think about the mental health of your workforce.
Work-related stress, I think, is being more and more understood as one of the key factors that leads to everything from more accidents to lower productivity. And there's a much wider debate, I think, now about the ideas of well-being. But stress is recognised now as the biggest source of absenteeism. So I run the professional body for HR. We've done research on it and showing that stress is the biggest source of absenteeism. But as I said, also it impacts other outcomes such as productivity. So we want to see, I think all of us want to see a stronger focus on this, but also what are the right interventions? What are the ways in which we can support employees and workers in their organisations around these issues?
What we found is that by opening up the conversation around mental health in the workplace, is that more people are coming forward, more people are willing to talk about what they've experienced, and that in turn has had a knock-on effect and given other people the confidence to talk about what's going on.
I think in terms of what employers need to pay attention to, first of all is, can we understand, is there evidence, what measures we're using to understand workplace stress? Now that might come through things like employee surveys, but it can come through other evidence such as increasing absenteeism from work. So that's the place we have to start, and then understanding what are the interventions that work. And again, there's a big body of evidence for that. The HSE has got data on this about what interventions that work. But I do believe it starts with an awareness, and an awareness from the top of organisations about how important this is, and then understanding their own context of the organisation. Where is that workforce in terms of how it perceives and deals with stress?
We have started our wellbeing programme by doing a big survey. So in November last year, rather than parachuting a lot of interventions into the organisation, we wanted to understand where we were and what our baseline was.
In BT, we've had a mental health strategy now for almost 20 years. And what we've aimed to do is put in place a structured approach that prevents problems in the first place, if we can, that intervenes early when problems first start to manifest, and then that focuses on helping people who do become ill get back to work safely and effectively.
It really is about organisations creating a climate in which people feel psychologically safe, they feel confident, and I think the role of the line manager is extremely important because managers often don't feel confident. It's not that they don't care. I don't think I've ever met anybody who really doesn't care. I think it's that lack of confidence that people feel. They worry about what response they'll get if they open up the conversation. And I think the kind of work that HSE's been doing, and the many other sort of third sector organisations within the UK are really opening up and facilitating that conversation within the workplace, but plenty more to be done.
At Thames Water, we've introduced a plethora of initiatives to support health and well-being. Adoption of the stress management standards from HSE played a vital role in terms of supporting us to enable us to put together appropriate risk assessments that allow us to better support our employees whilst in work.
So we initiated our programme before the HSE management standards had been developed, but we were keen from the start to work closely with HSE, and I like to think that it was a two-way process of sharing information that influenced the development of the management standards. But as soon as they were published, what we did was embedded them in everything that we do. And so it underpins our whole approach to mental health in the workplace. But what it also does is it feeds into the way that we train our people, particularly our managers. So if you look at our management training now, you will see that management standards approach in every aspect of their training.
Occupational health is a leadership issue. I believe you start from a principle that I have a duty of care to my employees, and that starts from the very top. And if I understand that part of that duty of care is about their health, then I should be talking about that from the highest levels of an organisation. But we've also got to train our people more, certainly through the line management ranks and middle ranks of organisations, as to what is the responsibility of every line manager to help understand the well-being of their employees, understand occupational health issues, how to talk to employees, for example, about stress and emotional issues, just as much as they can observe and support around physical well-being and health issues.
Leadership is, I think, the most critical thing in terms of occupational health and well-being. So having a leadership understanding of what good provision looks like and having the investment and support there will make it successful. It's also those leadership behaviours will often inform the behaviours that come in all the tiers of the organisation.
So the benefits to organisations clearly are that if overall you can evidence the fact that the organisation well-being, it's how it's dealing with stress and lowering stress levels in the organisation, fewer accidents, lower absenteeism. They're very tangible outcomes for organisations, and ultimately things like productivity, as well as your ability even to attract and retain staff. I think there's a much higher expectation now for most people in work that they will come to work, they'll be well treated, they'll be looked after, and they won't be compromised in terms of their physical and emotional well-being. And if we can demonstrate those things, they're also very good in terms of the wider image and brand, if you will, for employers.
Benefits are very simple to understand. Very clearly, it is to ensure that all our people go home safe and well at the end of every day.